Good morning and welcome to Business Community Spotlight right here on Legends 100.3. Mike McGann here with you as I always am. And I love to talk with you about local businesses and local products and services. Palm Beach County, there's a gold mine of local services that are right here at our disposal. And, listen, I turned 53 not too long ago, focusing on health and especially health that is, things that can be of benefit to your health in a natural way, in a way that can provide relief for some of those things that might have been building up, be preventive. Look, I know I'm 53, but we're all living longer. We need to make sure we're being preventive. We need to know that we are taking care of ourselves in the best possible way with the least amount of side effects, the way that's going to work out best for us and for our families. And I am a huge fan of chiropractic in general. I have had some fantastic results with chiropractic in my life. In fact, it's been way too long since I've been to a chiropractic office. So to that end, I'm very happy to have with me today a gentleman by the name of Dr. David Quartell of Quartell Chiropractic. Good morning, doctor. How are you?
Good morning. I'm doing well. Thank you.
Well, that's great. Great to see you. And I'm going to give you a phone number to write down if you have any questions or would like to set up an appointment, a consultation with Quartell Chiropractic. The number is 561-625-5556. That's so easy to remember. 561-625-5556 for Quartell Chiropractic. Now, Dr. Quartell, I've been someone that's enjoyed the benefits of chiropractic pretty often in my time. It's been way too long since I've been to an office, like I said. But, there are a lot of people who still don't have a basic understanding of what chiropractic is. They just think, well, all right, the neck, the back gets cracked, you move on. It's way more than that. The benefits for just a vast number of conditions are right there baked into chiropractic. So let's talk about it. What is chiropractic and how did you get into this?
So chiropractic is a healing art that utilizes the natural recuperative powers of the body and allowing the body to help heal itself, manufacturing a way that the body can become healthier from within without the use of pills, potions, or lotions. From a young age, I wanted to be a doctor. It was something my parents instilled.
Sure.
And I can remember when I was young, my dad would say, "Oh, don't worry about taking care of your health. There's going to be a pill to fix something someday."
Oh, wow. Okay, that's quite a statement.
Yeah, it really was. And both my parents, unfortunately, had terrible health.
Okay.
Because they were waiting for that pill.
That pill to come out, right?
And it didn't.
Wow.
Yeah, it never came out.
I've never heard that perspective before.
Yeah, it was, in the 50s and the 60s and the 70s, antibiotics were becoming bigger. They were discovering newer drugs for diabetes, for heart disease. And don't worry, right around the corner, there's something else. So don't worry about taking care of the engine because we'll fix it at some point later.
But if you look at this now, there's a pill for everything, right? Mm-hmm. But then look at the list of side effects on commercials. I do a lot of commercials and I've seen those lists and it's like, wait a minute. Now almost everything says doctors have determined that the risks may be outweighed by the rewards. What have we gotten ourselves into here?
We've gotten ourselves into a real Pandora's box.
We really have, Doc.
There's no such thing as a side effect. It's just wanted and unwanted effects.
That's a good point. That's
right?
Well said.
Yeah, so they're all effects. And when you're using a pill to try to treat a disease, mm-hmm. It's like using an air filter to try to get rid of the smoke from a fire inside the house.
Wow, that's a really powerful way to put it. Put the fire out, and then the smoke kind of takes care of itself, doesn't it?
Yeah. So what we focus on is root cause.
Okay, good.
Instead of worrying about mopping up after there's a hole in the roof, go fix the roof.
In the meantime, you're getting worse damage from the water coming in anyway, and that's going to happen if the root causes are not treated.
Correct. Yeah. If you just focus on the symptom, if you focus on how a disease is making you feel instead of getting to the root cause, the body just decays further and further and further, and then you're left with a body that doesn't work.
And the thing is, that would seem to be so intuitive. That rings so true when you say it, when you think about it. But in a lot of ways, we've been conditioned not to look at it that way. Take a pill to deal with the pain. Take another pill when that pill wears off. But you know what? Whatever's causing that pain in the first place, it's getting worse and worse, and your body is getting hooked on the pills. It's like we've got to destroy this village in order to save it, but you're not really saving a damn thing in the long term.
No, you're definitely not. And that the saving the village is a globally known statement, but the one in healthcare, we usually say the surgery was a success, but the patient died.
You know what? I've heard that said before.
Yeah.
And we can say it with kind of a dark laugh, but the fact is, that's truly how it's handled.
It is. And what happens in most healthcare settings, you're seeing a doctor for a very specific condition.
Yes.
You go to the cardiologist, and the cardiologist might be treating you for, let's say, blood pressure or blockage in an artery, but not concerning themselves with the effect on the liver, the kidneys, or the gastrointestinal system. And then you go to the GI doctor because you're having a side effect to the cardiac, and then they treat without worrying about the side effects or unwanted effects to the neurological system. And it's just a round robin where it's not getting to the root cause.
And it's almost hitting me, the old Hippocratic Oath, right? First, do no harm. It kind of seems like, well, yeah, the harm will be second.
Yeah.
And it's incredible to me. Chiropractic is the polar opposite of that. I've seen the effects of it. I've felt the effects of it. I told you off the air before we got here, I went to a chiropractor for a while a couple years ago. It was just pre-pandemic, and of course, everything kind of shut down then.
Mm-hmm.
But I ended up being about an inch and a half taller. I'm like 6'2" naturally.
Right.
And I had that height back. I was sleeping without pain. I have such severe head and neck pain all the time. I actually went to the hospital once thinking I was having an aneurysm. Mm-hmm. No. It was a neck pain brought on by bad posture, pinched nerves because of it. Don't even get me started on pinched nerves and the effects they can have all over the body. And that's just one aspect of it.
Yeah, just one aspect. The pain is probably the biggest driver, the bread and butter in our office.
Certainly.
People that come to see us, mostly with pain associated with sleep, pain associated with sitting all day at work, or an inability to perform some activity. Like, I want to get back to exercise or something, but I can't because this always happens.
Right.
And that's really what drives people to the office. But the majority of the patients that I work with continue to utilize our services because they feel other body areas getting better over time. I didn't know my posture feels better now, or my blood pressure is lower, my digestion is easier. These are all effects, wanted effects that occur when we're treating pain and distortion in the body.
What we found when I was there actually was that one of my hips was frozen in a sitting position and probably had been there for a lot of years, which I didn't know it was causing all this pain down one side of my body, my leg. There were some sciatic issues around it. And when that freed up, it was amazing. I had no concept that was even wrong. We found it there. And, you're going to find a lot of paths to health in chiropractic, particularly Quartell.
Yeah, so it's not uncommon that patients will find something wrong that they didn't even know.
Yeah.
The body has an ability to shut down proprioceptive input. For instance, if you're wearing shoes or socks or a watch, after a certain amount of time, you don't feel it anymore.
Right.
The body will give signals, and then when you're not paying attention to the signal, you just start ignoring it. So there are joint dysfunctions, movement pattern loss, or muscle loss of normal function that you just don't even signal anymore. And it creates further problems down the line.
Well, you can get that dealt with. Head over to Quartell Chiropractic, get that consultation, find out more. You can call 561-625-5556 to find out more, 561-625-5556. So let's talk, Dr. Quartell, about Quartell Chiropractic. What sets you apart? What's a visit like there? Let's talk about your business.
So experience is one thing that sets us apart. I've been in practice in the Gardens since 1999.
Wow.
I tell people since before the turn of the century.
Yeah, it's a quarter century since then, which is amazing to think
it's
about.
A long
wow,
time.
That's a great deal of experience.
Yeah, almost 3 decades of working with patients, over 180,000 patient experiences.
Wow.
During that time. So there's nothing that can really substitute for experience. And then in the office, we have x-rays on site, digital x-ray on site. So if we need to see further, we can do that.
Right.
And the exam that we have is mostly focused on your needs or your biggest health worry at the point.
Okay.
Most people do come to see us, again, with a neuromusculoskeletal condition.
Sure.
But we employ what we call the DREAM protocol, and it's 5 factors of health, looking at your diet, your rest, your energy, your anatomy, and your mental resilience. And those 5 factors are the 5 components that build health.
Wow. Mental resilience.
Yes.
Let's talk about how that fits into that program.
So we're living in a time and an age where there's a tremendous amount of information coming at us all the time.
Nonstop.
And it's easy to have anxiety build up and build up. There's no way to stop the anxiety from building if you have things coming at you unless you learn to deflect. So the phrase that I usually use with patients is you can't stop the waves, but you can learn to surf.
Learn to surf. What a great way to put it.
Right? So mental resilience is a huge component. If you have high mental stress, you're not going to have the energy to do your exercise you want to do. You're going to have high cortisol levels. Your hormones are going to be out of balance. Your nervous system is going to be on edge, and everything becomes tougher. And in and of itself, that's not the most important component of your health. But if it's the one that's suffering the most, it now becomes the most important component.
Well, I can tell you, I mean, it's the ripple effect from that, from nervous conditions. And I mean, look, anything that is going to disrupt the sleep pattern, whether it's pain, whether it's stress. I heard recently, funnily enough, I was talking to someone a couple days ago who had learned that firefighters actually have a very high suicide rate. And part of that is attributed to the fact that their sleep schedule is a mess because, when they're on, they can get called any time. That sleep disruption affects everything. Imagine being in pain all the time like that if there's an issue that's causing that. If there's a stress issue keeping you awake at night, the effects on the mental health, then what that does to the physical health, which comes right back around to the mental health. It's a spiral.
Yeah, it's a big ping pong back and forth.
It really is.
The rest becomes affected. That affects your energy, which then affects your mental resilience, which affects your movement pattern, which affects your food choices, which then affects your energy, So it's what we attempt to do in the office is identify the primary component that you're suffering from and then work on that.
Okay.
And then as that becomes better, we work on the others. Being a chiropractor, the majority of the ones that I see are anatomical in basis.
Certainly.
But diet is probably the next one that we see as common. Yeah, because we eat the standard American diet, the SAD diet.
SAD. I've always loved that. Such a true acronym.
Yeah, and it's terribly destructive because it's a twofold whammy. The first is we're not getting the nutrients we need. And the second is we're bringing in toxins that damage the body. And together, it creates an environment inside where the body can't work the way that it should. It disrupts the microbiome, it disrupts metabolic activity, it saps your energy and strength, and you don't have the necessary components to rebuild and repair.
I see these pictures. They're posted. You can never really believe what you see online, but it's a picture of these teenagers on the beach in the 1960s. And they're all in great shape. They look great. And it's saying, well, what's the difference? And a lot of that is that diet. A lot of it is we eat so many more processed foods. We're so much more sugar dependent, all this. It's a part of it. And I think that integrated approach to the diet, to the musculoskeletal, to the neuro and the mental, the 5 things you mentioned earlier, really have to come together to create that total picture of health. And that is the specialty at Quartell Chiropractic. Let's talk about some of the treatment modalities that you bring to the table under that chiropractic umbrella.
So my primary treatment is by hand chiropractic adjustments.
Sure.
Unfortunately, within the field, and I don't know why this is happening, but fewer and fewer chiropractors actually put their hands on patients.
Really?
Yeah.
How do you get? I mean, no two patients are going to be alike. Everybody's going to, and your experience, almost 30 years with this, it's going to allow you to feel those differences, to literally feel them and work with them for an individual's care. You'd think that would be primary, and it's kind of frightening to think that there are chiropractors moving away from that.
I would think it should be primary.
It's pretty terrifying.
It is.
Yeah.
My daughter's in chiropractic school right now. She just finished up her second year, so I have a cousin who just finished up about 2 years ago. So I have a good perspective on what they're teaching, and it's just not as much hands-on. So that's the primary work that we do in the office, hands-on chiropractic work.
Right.
We have some very skilled massage therapists. We do dry needling in the office as well,
Okay.
Which is an effective tool to get some muscle and fascia response that we can't necessarily reach by hand.
Sure.
We do a lot of nutritional work to help supplement those people that aren't eating 10 to 15 servings of fresh fruits and vegetables every day.
Okay, I'm sorry. Did you say 10 to 15 servings of fresh fruits and vegetables a day?
Yeah.
Wow, that's quite a number. And I literally cannot think of anyone I know who does that.
No, most people don't, which
No.
is why supplementation is important.
Okay.
And we use the term supplementation purposefully because it's a supplement to the diet.
Not a
And
diet in and of itself.
It's not a diet in and of
Right.
itself.
It's not going to. That's that magic pill we talked about earlier. It's
No.
not a thing.
Yeah, so you need to supplement the diet. If you,
Right.
if you weren't making enough money at the end of the year, you might supplement your income with an extra job.
Exactly.
If you're not eating enough nutrient at the end of the day, you might supplement your intake with a vitamin, mineral, or some other. So we do a lot of nutritional work in the office as well.
Okay. It's not your primary diet, but it's added to the correct primary diet to make sure you get what you need.
It is. And then we also do quite a bit of lab testing in the office.
Okay.
Most of our patients do get labs with their traditional medical doctor, but labs at the traditional doctor's office are typically limited by three things.
Okay.
One, what is the insurance going to pay for?
Big one.
Two, does the doctor know how to read the lab? And three, is there a pharmaceutical treatment in case the lab comes back out of range?
Okay.
If the lab doesn't satisfy those three requirements, typically the labs won't be ordered. So we do quite a bit of extra lab testing, do full cardiac panels, do
Okay.
full inflammatory panels. We look at the energy metabolism in the body, not just the glucose levels. We also do some genetic testing looking for metabolic deficiencies that can be influencing the way the body is resting and repairing. We also do food tolerance testings, environmental testing, even heavy metals. And these are commonly known labs. They're just not oftentimes recommended because there's no easy pill fix.
Wow. But you think to get that complete picture of an individual's health, and no two are the same. Once again, I think that's why the individual, why this complete picture is so necessary. You're not going to get that in a traditional Western medical office. And I'm not necessarily knocking Western medicine. I mean, thank God for antibiotics. These are,
Thank God.
For me, East and West can come together here. But I think that combination is so key. But getting that full picture with all of that information is going to allow for a more appropriate, complete diagnosis and a more complete recovery plan.
It absolutely will. And this is generally the approach that we take for someone who's suffering with a chronic problem or a subclinical problem. The approach that's typically taken in the medical field is one that would be employed in critical care or emergency situation. If there's a critical need, I don't want to be anywhere but in the U.S.
Gotcha,
Heart
sure.
attack, stroke,
Right,
major
absolutely.
accident, injury, go to the emergency room and you're going to get the most phenomenal care available.
Yes.
But the problem exists when we use that emergency care intervention for chronic disease condition. So we're using the same tools and diagnostic criteria for someone with a chronic disease. It doesn't work. This is why we see cancer rates, dementia, heart disease growing faster and faster, diabetes growing faster and faster, and we don't hear about it in the news as a primary problem. It's more, what additional drug can we take? What additional drug can we take?
I don't know. It seems so backwards to me. It just seems that's beginning at the end instead of beginning at the beginning. Beginning at the beginning is what you do. That's what Quartell Chiropractic is all about. It's about getting that complete picture, finding the root causes of those, which will eventually, by the way, prevent other issues in a big way, and also deal with ones that are kind of a halo from the first one. It's complete care.
It is complete care. And what we do is we set up a system of treatment that looks at you at 100 years of age.
Okay.
Right. So there are a couple of milestones in our life. When we're kids, I can't wait to be 10. Then we can't wait to be a teenager. And then, so as we get older, so, I'm closer to 60 now than I care to be. But the first real hurdle as we're nearing our older age is how do we avoid the four major causes of chronic disease: cancer, heart disease, dementia, and diabetes.
Okay.
And if you can overcome those four conditions, the last thing you have to worry about is frailty. And if you avoid frailty, you can make it to 100 dancing and singing. But if you're in a wheelchair and you're at 73 and you can't walk up a flight of stairs, your happiness level is going to be very low.
Quality of life issue, right?
Quality of life
And
issue.
now we're living longer than ever because there are a pill for a million things. But if you're, and in fact, I should probably put living in quotes there, which I kind of hate to say, but it's true.
Yeah, thriving.
Thriving is a much better way to put that.
That's
Doc.
what we say. Yeah, living and thriving, they're two entirely different things.
They really are. Someone, look, I'm not sure if I should put it this way, but someone who is being kept alive on a respirator is living.
Correct.
But they're not necessarily living their best life. The one who is, playing the golf and the tennis, if that's their thing,
Right.
the ones who are able to go out and, celebrate their life, go to the shows that they want to go to, garden if they choose to. Again, choice, right? It's being able to do the things that you want to be able to choose to do.
Correct.
That's quality of life. That means dealing with those root causes. That means those 4 areas. And I'm going to see if I can remember them. Cancer, heart disease, dementia, diabetes, right?
Yeah, those are the 4 big ones.
If you can work through those, prevent them, then your quality of life is going to be a night and day. And that's what Quartell Chiropractic brings to the table. Let's talk about what an initial consultation might be like. If somebody gave you a call, 561-625-5556, 561-625-5556, and made an appointment, let's talk about what that appointment looks like.
So I typically spend about a half hour with a patient at the first visit, discussing needs, finding out where their primary complaint is, what brought them into the office, and then going through other aspects of their life where they want to see improvement. If somebody doesn't want to change their diet, we're not thrusting dietary change down their gullet.
Sure.
Right? I'll meet patients where their needs and wants are, but most times people just want to be healthier and happier. So we look for the most easily addressable conditions. I'm a big fan of low-hanging fruit.
Start there, right? Sure.
Yeah, start there. Like if we can do these 3 things and you're 30% better, wouldn't that be a success? And, sometimes I'll get like and then I suggest, well, what if you were 30% worse? All of a sudden, 30% seems significant.
And it is. I mean, that's no
is.
joke. That's a big number. Statistically speaking, that's massive.
So what we do is we do some work and we see some progression. We'll take some x-rays. We'll look at what their needs are, their time, what their effort is to put in. And then we work together. And as long as they're getting results and progression, we continue to work. And if there's a plateau or the results just aren't there anymore, then we stop and reevaluate. But most people, as long as they're getting good results, want to continue the path.
I get that. And I mean, it's something I've experienced with chiropractic, but I love your approach. I mean, it seems to set it apart. You've got the technology to go with it as well. You've got that digital x-ray. You've got those lab panels. You've got it all in one spot. And I mean, to me, that would seem to me to be intuitively the best kind of a care plan. Now, sadly enough, it's counterintuitive in this day and age, but you're doing it. That is your focus, Dr. Quartell.
Yeah, because it works.
It
works.
It's just that simple. It works.
Yeah.
What more can you say about something? I mean, simplicity in this case, right? What could be simpler than making sure you're in alignment, making sure your diet is proper, making sure that you're learning mentally to deal with things? It works. That's the simplicity. That's the magic. And that's also what is so ignored these days.
It is. And, most times you'll hear about a chiropractor that can help with sciatica, headaches, shoulder pain, neck pain. And at this point in my career, those are relatively easy to work with.
Right.
And the real joy comes from, seeing somebody being able to do something that they hadn't ever thought they could do again.
Wow. That's a powerful thing. But I mean, that's good medicine, right?
It's good medicine.
That is good medicine.
Yeah.
That's not just first do no harm. That is, do a heck of a lot of good. That is taking quality of life. As you said before, surviving versus thriving. That's a pathway to thriving. And it's also making it a lot easier to walk that path or dance that path or bike down that path, whatever you want to do with it.
Precisely.
It's what you're doing. Your mission is so important. It's full health. It's dealing with that pain that's in the way right now. It's dealing with those conditions that are in the way right now, that low-hanging fruit, and then being able to climb that tree higher and higher. And that's what you're able to do at Quartell Chiropractic with those treatment modalities, with dealing with the root causes, which looking at that entire person, spending a half hour instead of the normal, 4 to 7 minutes that we get at a regular doctor?
Usually looking at the back of their head while they're typing on a keyboard.
Every single time, right? And then am I even going to see that? Am I going to know what it means? No to most of them. And are they going to get the appropriate blood work? Well, that all depends on your insurance and this and that. Not the case at Quartell Chiropractic.
Not the case at all.
Set it up. If you listen, even if you think you're feeling good right now, imagine what it would be like if you felt 30% better, right? Mm-hmm. Then imagine what it would be like if you felt 30% worse. That 30% better, it's a goal worth looking toward. And think about the fact, are you wearing a watch? Do you remember you're wearing that watch? You might have aches, pains, issues that you've gotten so used to that you don't feel them anymore. A light can be shined upon that. That can be taken away. That pain that you may not even know you have. But it starts with that phone call. It starts with saying, you know what? Things could be better. If they're bad, they can be better. If they're good, they can be even better. Reach out to Quartell Chiropractic today. Dr. Dave's a great guy. I've had an awesome time with this conversation with him today.
Thanks.
He's got a great manner. He understands what it's like to communicate with another human being, not in dealing with a number or a computer program. This is a gentleman you're going to want to talk to.
Oh, yeah. Thank you.
So, reach out, set it up, get that consultation. Call 561-625-5556. 561-625-5556. Where's your office, Dr. Quartell?
I'm in Palm Beach Gardens on Military Trail, just south of PGA Boulevard, right across from the municipal complex, fire station. Yeah.
Oh, yeah, I know that spot very well.
Yeah.
So check it out. Quartell Chiropractic, 561-625-5556. If you're having issues, they're going to get better. If you're not, they still might get better. So make that call, 561-625-5556, Quartell Chiropractic. Dr. David Quartell, thank you for your time, and thank you for what you do for individuals and this community here in Palm Beach County. It's paradise, and you can make that paradise brighter.
Well, thank you so much for having me today.
Anytime. Quartell Chiropractic, 561-625-5556. This has been Business Community Spotlight on Legends 100.3. I'm Mike McGann. Stick around. Lots more legendary programming to come.